for tuning in to Ageless Living here on Voice America and World Talk Radio. This is Kurt Wilhelm, your co-host of Ageless Living, and
this is Dr. Li.
Thank you for tuning in. And Dr. Li is the person who has all the amazing certifications. I'm just here enjoying the ride and being part of the discussion, learning so much from Dr. Li. Also, don't forget our sponsor, azmdlaser.com. Go there for Arizona Laser and Skin, where you can go for comprehensive beauty and image therapy, ranging all the way from holistic treatments all the way through to cosmetic surgery. We are joined today by Dr. Robledo, who, after we share our tip, is going to be joining us because he is a licensed ear, nose, and throat specialist, and he's going to talk about something that might be near and dear to your heart more than you can think or believe. It is snoring. So even if you're not worried about your snoring, believe me, your partner is.
Someone else is.
So, Dr. Li, tell us how we might be able to resolve some of our snoring issues.
Well, as a anesthesiologist, that's the other part of the work I do. We encounter patients during surgery. Snoring is a concern because they're usually related to sleep apnea. I mean, not usually. A lot of times they
Sleep
are.
apnea is?
Sleep apnea is someone who actually stops breathing during deep sleep. And usually, if there's a sleep partner, they can tell you that. If there isn't, you're going to wake up the next day tired, not rested, and it's not good for you. It's not good for your brain function.
So if you snore, there's a good chance it's also not good for you in the way you're sleeping as well.
That's correct. It's definitely not good for your sleep partner's resting. So it's actually a condition a lot of people are seeking help for. Here we have an expert in this field, and I have a little health tip on that I want to share first. So as well as I know, not a lot of modern medicine techniques are effective in consistently treating snoring. And I ran over this piece of information over the Chinese literature. Well, thank goodness of my bilingual ability.
I saw the email and I said, I think I believe it.
I was really amazed seeing there's a tea that can actually help with snoring. I'm like saying, let me see what it is, and if it's safe, hey, you know what? It's worth a trying. I have since tried it on a couple family members and friends, and they have all reported to me good results. Not magical, but definitely significant improvements. And this is using something called Szechuan peppercorn. They're available in all Oriental stores. So in Phoenix, there's a Lily's Market, there's the Chinese Cultural Center, and some other stores. You basically pick about 10 of those peppercorn and put it in a small cup of water and boil in a microwave and drink that liquid. You don't have to eat the peppercorn.
Okay.
5 to 10 days each night before going to sleep. And I have observed people having very much improved in snoring. Okay. So you either stop snoring or snoring a lot less.
Very good. It's good to know. If you care about your loved one, or your loved one cares about you, or you have a loved one who snores, give it a try.
Right. And if you have any questions, you can email us at tongli.md@gmail.com. That is tongli.md@gmail.com, or visit us on our website at www.azmdlaser.com.
And email us your results. So now there may be other options and strategies that are a little bit more invasive. So Dr. Robledo, share with us some ideas that they might do in conjunction with this.
Sure. First of all, snoring is more than nothing, is a social problem. You know, it's annoying. It can be annoying to the partners of the person that snores, but it can also be a medical problem. Like Dr. Li mentioned before, snoring can be associated with sleep apnea. We say that sleep apnea almost everybody with sleep apnea snores, but not everybody that snores has sleep apnea. So that should be something that should be determined. If the person does have sleep apnea, it goes beyond being social, it's a medical problem, it should be evaluated. There are sleep labs that do this evaluation. Because sleep apnea can affect your blood pressure and other situations, it's something that needs to be addressed. As far as the snoring goes, we have devised many kind of procedures to improve that, to make it less noisy, or to improve the airway. And these all have certain benefits. But I stress, it's important to evaluate the patient completely.
Okay, wonderful. And are there, and so there are surgical methods which we may go into at another time, or you can call for a free consultation with Dr. Robledo or Dr. Li at?
The phone number is 480-598-9733. You can visit us on our website, azmdlaser.com. And our phone number once again is 480-598-9733.
Wonderful. And I do appreciate you offering our listeners that free consultation. And again, thank you for tuning in to Ageless Living here on Voice America. This is Kurt Wilhelm, your co-host of Ageless Living, and
your host, Dr. Li.
thank you for tuning in. We'll see you next week.